Good day, my dear postgraduate students. Welcome to the new class on Glide the Slide. In last class, at the end of it, I had given you a history. A 15-year-old boy presented with vesicular lesions. Nothing more than that is given. Looking at the picture, what is your diagnosis? What is the procedure that has been done? Where else can it be applied? So this we shall see in Glide the Slide number 10. R.A.T.S for PGs. Now what are we seeing on the screen? I am finding large cells. How do I say it is large? Probably there are some other smaller cells. I will have to compare it well. Even if it happens to be a nucleus, much larger than these. So I find that large cells with large nucleus are there. And in some cases, the nuclei appear to be inseparable or not separated from each other. I hope you people have come to a diagnosis. Even otherwise, look at this picture again. I find that it is much clearer than the colored picture, wherein I am finding multinucleated large cell. And there is a kind of cohesion of the nuclei. Some books or some people call them as nuclear molding. So the procedure that has been done was the Zank smear. The Zank smear is nothing but making a slit and then a smear in preferably the bullous lesions of the skin. It was practiced by one Zank, a dermatologist. It can be for immunobullous lesions, such as pemphigus vulgaris, wherein there can be acantholytic cells. Staphylococcal scalded skin syndrome, dyskeratotic acantholytic cells. It can be for infective etiologies, such as leishmaniasis. You get Leishman, Donovan bodies. Herpes simplex or varicella zoster. You get multinucleated giant cells with molding. Molluscum contagiosum, Henderson, Patterson, or the molluscum bodies. Others, you can get Haley disease, acantholysis, Darius disease, Cobb's, Ron's, and Graves, and Paget's disease of breast, the Paget cells. In fact, any one of these can be given as a slide to us. That we shall visit at a later date. So this is the Zank smear, and it has been made in a case of a herpes zoster patient. Now look at these are probably the neutrophils, and you can compare the size of it. So it is from an active skin lesion or sometimes in the genitalia, wherein you find that the Zank cells are in herpes simplex, ulcers, etc. and the lesions that I had mentioned earlier. Varicella zoster is again a close relative of the herpes zoster. Pemphigus vulgaris, an autoimmune disorder, and cytomegalovirus. So the list goes on. But what I would like you people to appreciate is large cells, large nucleus, multinucleated cells, nuclear molding. And it is obviously a smear because I'm not finding any tissue background. So this is the general mode by which a virus multiplies. It cannot multiply on its own, though it is devastating, including our cytomegalovirus or anything. So this is a herpes virus. Initially, there is an attachment to the human cell. There is a host receptor, and it goes inside. And what happens is it makes use of the host tissue to form a cell membrane. There is an uncoating, and then the nuclear material is being released. This gets attached to the host chromosome, as a viral episode. There is a multiplication and then there is a proliferation of the viruses without the capsule. And what happens is these again make use of the host tissue to form the capsule and get released. So you find that one has become many viruses. This story goes on even in HIV. Incidentally, there are certain things for us to understand. Viral inclusion bodies. It used to be a question for us, but this is an interesting table that I came across. I would like you people to kindly note it down. It can be intracytoplasmic or intranuclear. Intracytoplasmic, molluscum contagiosum, Henderson-Peterson bodies. Rabies, the Negri bodies. Smallpox, Guayapneri bodies. And the passion bodies. Foulpox, Bollinger bodies. And foulpox again, boral bodies. These are certain things from microbiology. Acidophilic, there can be Cowdrey A and Cowdrey B, which can be seen in varicella zoster, herpes zoster, yellow fever, and the polio virus. And basophilic, Cowdrey B type adenovirus and cytomegalovirus. All these will be forming the intranuclear inclusions. This is intracytoplasmic inclusions. And how is this Zank smear being done? There is a blister and then there is a punch or a slit that is being made and the serum can be taken for fluorescence. But then what we do is with the help of another slide, there is a smear that is being made. Look at this. The area is cleaned and allowed to dry. A needle is inserted at the base of the blister. The smear is taken and the base of the blister that contains the acantholytic cells. And the smear is taken just like your peripheral blood smear or the bone marrow, and a Leishman stain is being done, or a GMSR stain. The smear shows the presence of the Zank cell, which is the detachment or the disintegration and the dissolution of the normal squamous cells. So these are all modifications of the squamous cell, but what we are interested in is the content rather than the cover. We shall glide to the next slide. This is straight away a slide for diagnosis. A few differentials will be there which will be considered. See you in next class.